I just want to see you move it all.
Going to give people just a second to get on the phone. Okay, so welcome everybody to our second or third? Second carrier onboarding meeting. For those of you that are in this room, that mic picks up everything, so don't say anything nasty about your neighbors. I'm going to start off with taking roll. I'd like one person from each carrier to identify themselves. We'll start with this in this room.
Matthew Laddick, Hometown Health.
Hometown Health. Anybody on the phone?
Lindsay Cole and Terry Allen's Liberty Dental Plan.
Liberty Dental.
United Healthcare.
United.
Health Plan Services.
That was
Nevada Health Co-op.
And who spoke after Health Plan Services?
Nevada Health Co-op.
Co-op.
St. Mary's Health Plan.
St. Mary's.
Hello, Anthem here.
Anthem's here.
Coventry Healthcare.
Coventry.
Premier Access.
Premier Access.
Nevada Dental Benefits.
Was that Nevada Dental Benefits?
That is correct.
Anybody else? Is there anybody from AHIP
Nevada.
online? Somebody. Go ahead.
Anthem Blue Cross.
Anthem, okay. All right, so I've got Hometown Health, Liberty Dental, United, Health Plan Services, Co-op, St. Mary's, Anthem, Coventry, Premier Access, and Nevada Dental Benefits. Did I miss anybody? So for those of you who are on the phone, please put your phone on mute until you decide to say something. Please also do not put us on hold. If you need to answer another call or do something else, please hang up and then redial. Otherwise, we get that lovely elevator music. So with that, again, welcome to the second carrier onboarding meeting. The previous one was held, I believe it was February 27th. You can get the notes from that meeting on our webpage, exchange.nb.gov. Go to resources, carrier onboarding, and carrier onboarding, and then there's the first link takes you to the list of meetings. Today we are scheduled to talk about basically general information, rate plans and benefits, IT requirements, and then we have questions and answers. We received some questions from one carrier. Those have been posted on our website, and we've got a couple of minor changes to the current presentation, and we'll get to that when we get to those specific slides. So with that, before I turn it over to Chad Hogan, can everybody hear me on the phone okay? Let's take St. Mary's. Can you hear me on the phone okay?
Yes, I can.
Okay, great. All right, so with that, I'm going to turn it over to Chad Hogan, and he's going to go through the presentation for today.
Good morning, everyone. Thank you for attending the carrier onboarding session here. Specifically, as John mentioned, we're going to be looking at rates, plans, and benefits, general onboarding processes, as well as some IT requirements. My name is Chad Hogan. I'm the Senior Vice President of Choice Administrator Exchange Solutions, and we'll be here to walk you through this and answer any questions you have in regards to the processes we're discussing. So we're going to go ahead and start on page 4, which is an overview of the onboarding process. We're leveraging a workflow here provided by SURF. As you are probably well aware at this point in time, and if you're not, the state of Nevada for the exchange will be utilizing the SURF process. The SIRF stands for the System for Electronic Rate and Form Filing. We'll be using the defined files that have been created by CMS specifically to facilitate the onboarding and collection of health plan information, as well as various other data that's going to be helpful in the QHP certification process. So starting on page 4, we're going to go ahead and take a look here at the overall process overview, and this is from a SIRF perspective. On the next slide, we're going to talk a little bit about some of the prerequisites that will need to be done by the issuer prior to submitting data to SIRF. From the issuer's perspective, you'll be responsible for defining product as well as submitting the rate and form filings to the state DOI and SIRF. The state will follow their normal process for reviewing binders. A binder is a term that was developed by SIRF to indicate a collection of QHP information, and that is the process by which plans will be certified are in those binders. There's one change, as John mentioned, to this flow, in that the exchange will not be reviewing the applications. That entire process will be taking place in the DOI. Once DOI has reviewed the application as well as the plan information, it will then be certified by DOI. And once it is certified and that binder released, it will be made available to the exchange for their review. Once the information is reviewed, it will be made available to the QHPs in a staging environment for review of the data as submitted through SIRF prior to release. Once that information is reviewed, then for accuracy and to ensure that all of the information is being displayed appropriately as need be to the consumer, approval is then received from the health plan, and the plans are made available on the exchange portal pursuant to the exchange guidelines.
So the changes, basically those first 2 blocks on the bottom line for the exchange, both of those will be done by the Division of Insurance. The remaining blocks would stay with the exchange. So Chad, can you let so we're planning on having, theoretically, all plans will be certified by July 31st. There's a process, a preview process that Choice and Xerox will be working through.
Correct.
To make sure it can get into our system.
Right.
And then the carriers will be able to actually review it in our system, test it in our system, right?
Right. We're going to put together a plan preview period, which I believe will be in the August timeframe for them to view the health plan information. Again, we're working through the details of exactly when that will be, but that will be prior to go live, a plan preview to validate the information within the Exchange UI.
And about how much time do you expect the carriers to have to do that?
You know, I would imagine it's not going to be a lengthy period of time, probably around the 1-week time frame.
Okay, and is it possible there's a large volume of information to put onto the exchange from a lot of different carriers. So while we work through that process, will it be possible to say, all right, I've got this one done, send it over to the carrier to start doing this one. So it might be a week for a plan, but you might have that spread out so not everybody's slammed.
You know, it's going to depend upon when the binders are certified by DOI, when that information is released to us, and then coordination with overall testing plan. I think we would like to do that type of approach. We'll have to see as we get closer to release how feasible that is. Obviously, in terms of loading the plan data in there and staggering out for the health plans, we've got a compressed timeline, so I think we'll need to really define what that testing process looks like going forward.
So theoretically, a week per QHP, we might be able to spread that out over multiple QHPs. We've got to work through that process.
Possibly,
okay.
Yeah.
See, we're like the
This
feds,
is Lisa
everything
Kelly with
soon.
Anthem. I just have a question. And as part of that review that the issuers would be doing, what would that include? Reviewing the actual products and the benefits, the rates?
So really what
would that include?
And I'm sorry, I missed your name?
It's Lisa Kelly from Anthem.
Thank you.
So really what we're looking for in that review process is a validation from the issuer that their information is being displayed properly within the platform. we believe it will have been, but there will be integration links such as bringing up consumer SBCs, which, depending upon how you provide that data, may link back into your system to generate those dynamically, and again, validating that those plan IDs match up, that the integration back and forth between the various systems work. So really, it's a validation of the data, because it will have gone through the DOI certification process. So the data as provided to DOI is what will be provided to the exchange. So we're not really necessarily looking for rate validation or benefit validation. All that will have gone through the DOI process. However, we will be validating, if you want to run test censuses or things like that, just to ensure that what you're expecting to see come out is the output. You're certainly welcome to do that.
And so when you say that, does that mean that, like, I enter in a family of 4 and I see what my products are showing and I check to see that you're coming up with the correct rate for that quoting, or is that testing that would happen in review that would happen further down in the process?
That's testing that should take place prior to it being released to the issuer for review. Again, what we're looking for are touch points to your system, as well as validation, that all of your products are showing, that everything that you're expecting to see there is in fact being displayed.
Okay.
Okay. Are there any other questions about this slide?
Just real quick. So are you planning on providing maybe more details in a test plan on the expectations on the various levels of testing or verification points?
Yeah, we talked about that a little bit later in one of the slides. As we get closer to go live, we will provide a more detailed test plan around that. And just, who asked that question?
Pat Livingston from Atham.
So as we get closer to go live, we will publish a test plan for expectations from each of the issuers and what that'll look like, and what requirements will be required from each of the issuers for that testing.
So I'm going to commit to you right here, by middle of April, we'll have a draft test plan, a very basic framework, because we understand that you guys need to be able to allocate your resources. So we're going to put a draft test plan together with the understanding that it could change, but we want to get the information out to you as quickly as possible so you guys can allocate your resources for the summer.
Right.
Okay, thank you.
So moving on to slides 5 and 6. These are the 9 SURF templates. These are issued by SURF, or not, they're actually the CMS data template files, but they're being used in the SURF process. These were issued as of March 5th. It's our understanding that there is one of them that has still not been finalized by CMS, and that's the rate review template. However, there were 2 new templates that were added. If you've previously seen this information, they added the NCQA and the URAC accreditation templates. And so all in all, there's a total of 9 various templates that will collect data, and these will be the ones that are used in the Nevada Exchange Plan QHP certification process. All right, moving on to slide 7. I mentioned that there would be a few prerequisites prior to filing. One of the key interaction points is that each of the carriers or issuers will need to obtain plan IDs from HHS through the HIOS system for all new non-grandfathered plans in and out of the exchange prior to submitting binders to SURF. Part of those templates require those HIOS plan IDs. HIOS stands for Health Insurance Oversight System. It's the CMS backbone platform that they use to manage. So you will need to get your plan IDs from HIOS prior to processing those templates. Right now, SURF is on target to release their latest version, version 6, to the states at the end of March. They're targeting March 28th. As such, DOI has indicated that carriers can start filing beginning 4/1 for those rate templates.
Now that said, there are still a few things that we need to work through. For instance, you probably want to have rating areas before you submit rates. The Division of Insurance is working with SOCIO to establish the rating areas. Obviously, we have to set up network adequacy standards to do that as well. Please understand we are working as quickly as possible to come up with adequate standards for the market, with the understanding that we don't want to alienate any particular market, make the requirements so strict that you don't offer any coverage, say, in the rural areas. So it's obviously a balancing act. You guys are well aware of that. We're trying to make that work. And I think I talked about this before, but I'll go into it real briefly. It has been, I don't know if it's a policy, but the Division of Insurance has indicated that if we're going to require network adequacy for all products on the exchange as required by federal regulations, that we should do it for the entire market so that we don't have any kind of adverse selection issues. However, to be able to do that for the entire market requires a statutory change and regulatory changes, which cannot necessarily be implemented by April or May. So the intended process is we are going to go through the process of creating those standards through the federal authority that the board has to require network adequacy standards for the qualified health plans that are offered on the exchange. We're going to try to get that done in April, but it might be as late as May. We are trying to align that with the appropriate requirements for the rural areas. We understand that there are challenges in the rural areas. Again, we're not trying to alienate any particular carrier or any particular region of the state. So we're going to work through that. We're going to use the board's authority to set those standards for QHPs so that all of you can start submitting your plans as soon as possible. And then later on, once that statutory regulatory process catches up, then we'll start working with the Division of Insurance. I should say the Division of Insurance will start working with everybody to set those standards statewide. Our intent is to provide standards to the board that will, as much as possible, align with whatever ends up being those state standards. So a lot of discussions will be going on in the next couple months, next month, hopefully just the next month, and that'll be the end of it. We want to align that as closely as possible so there's not a bunch of shifting that has to go on. So that's kind of how we envision going forward with network adequacy. So those are the two big things we're working on: network adequacy, and when I say we, I mean the state in general, network adequacy and rating areas. And really what I mean is mostly the Division of Insurance. So please thank them for all of their hard work in getting this stuff done.
All right, moving on to slide number 8. Carriers will be able to offer 5 plans per metal tier per service area. Individual market plan offerings will be in place for 1 year, and changes to the individual market QHPs can be made annually, and that's prior to the open enrollment period. Rates must be set for an entire benefit year or for a plan year for products in the shop exchange.
So one thing to note, when we say 5 per metal tier, that includes the catastrophic plans. You can offer up to 5 catastrophic plans if you dare. On the shop side, the small group market open enrollment periods does not necessarily align with the calendar year, although it can, but it depends on when the employer comes to the exchange to purchase insurance. So if the employer comes to purchase insurance in March, for a May 1st effective date, theoretically that plan year can go from May 1st all the way through April 30th. We would expect that any rates that you have in place for that start date, whatever the first of that month start date is, that rate will be effective for the entire year. So for instance, if you set a rate that's effective January 1st, an employer whose plan year starts January 1st would have that rate from January 1st through December 31st. You could change rates for new enrollees, say April 1st, with the start of the new quarter, and so the rates for the second employer that enrolls on April 1st would have those plans in place from April 1st to March 31st. Those rates may differ from what the first employer has. They all have to be available for that entire plan year. So hopefully that makes sense. Now the other part to that is the exchange fee. There's been questions on how the exchange fee works. The exchange fee is charged from January 1st through December 31st. So the $4.95 per member per month is for calendar year 2014, regardless of whether or not the plan year for the small employer starts at a different time. So you'll have to think about that when you start the rates. Because of that, if you look at the notice of rate adoption that was, it's posted on our website. Again, that's exchange.ub.gov, resources, carrier onboarding. The bottom link to that is our adopted rates. The adopted rates are only for calendar year 2014, but we provide estimates for 15, 16, and 17. Now, those estimates could change, but they are in the ballpark of what we expect those to be, so that you can start planning ahead when you start looking at the small employer plans that will go into calendar year 2015.
So this is Lisa Kelly with Anthem. So what you just said was specific to SHOP, right, as far as the rates for a year. If the individual enrolled, like, open enrollment, and maybe they're effective in March 1st, then you would, everything kind of resets January 1st, correct?
That's correct. In the individual market, open enrollment will always be in the October, December timeframe.
Except for the first year.
What's that?
Except for the first year.
Yes. The first year it's October 1st through March 31st. Every year after that it's October 15th through December 7th. The initial effective date is always January 1st. Obviously the first year there's some delay. If you enroll after December 15th, there's between a 15 and 45 day enrollment delay. It's always the first of the month that's, it's either the next month if you enroll in the first half of the month, or it's the first of the following month after that. But regardless when you enroll, the rates will reset open enrollment in January 1st of the next year. Or if you had a special enrollment event and that allowed you to come on the exchange in the middle of the plan year, again, that you'll reset January 1st. So a little bit of different thinking from what currently happens, where that plan year could be in the middle of the year. The year will always end December 31st.
Okay, and that's in line with what I thought, so that's good to hear. Thanks.
Yeah, the concern that we had, there was discussion about whether or not it should be a year from when they start. The problem is, if it's a year from when they start, they can never get off that plan because they can only get on a new plan during open enrollment. So it really makes sense to start them over on January 1st of every year.
Except for if they have a special enrollment, something happens during the year and it allows them to change their plan.
Yeah, and the special enrollment events, yes, you could, depending on the special enrollment event, it's either a change in plan or simply adding or subtracting a dependent. So we're working through the federal regulations. I don't know, I think we'll have more detailed guidance on that. Speaking of that though, we are developing an eligibility section for your evidences of coverage. When we talked about this in the past, and I know we're getting slightly off topic here, but things come to mind, and here we go. So we have to provide you with the rules that we're going to require for eligibility. Those eligibility rules are typically in the evidences of coverage, and rather than let you all provide evidences of coverage that have eligibility rules that may or may not be accurate, we assume that they would be accurate, but we want to make sure that we provide you with the appropriate information. So rather than provide you with the appropriate information that you translate to your evidences of coverage, we are providing you with sample language to provide in your evidences of coverage. You can either cut and paste it and stick it in there, or do what you need to with it. The idea is that we want to make sure that that you are communicating to the public in your evidences of coverage the appropriate eligibility information. So hopefully that will help make your jobs a little bit easier going forward.
Right, and then our assumption then is that because since you are actually the police on eligibility, that then you would be following, it would be you you're making those eligibility determinations, not necessarily us. Although we would present it to the public, but it's the exchange that is in front of us, being that monitor, that police verification process, correct?
Yes, the exchange is the system of record for eligibility and enrollment for the exchange, for the enrollees on the exchange, and as such we need to make sure that we have standardized rules that everybody can understand and everybody can abide by, and then it just makes sense then that we provide you with the appropriate language. It's optional, you don't have to do it, but it would certainly, if it were me, make it simpler to be able to just cut and paste. So you guys can look at it when we publish that, hopefully soon, hopefully in the next month. We'll be able to provide that to you, and again, as with anything that we do, please provide us feedback if you're concerned about something. Just because we said it's the way it is, and we're from the state doesn't mean that we're not open to change. This is a collaborative process.
All right. So I'm going to kind of walk through some of just the high-level items that might be of interest in regards to the surf data templates, specifically addressing any potential changes that there might be from the data that's collected in those files versus what each of the issuers would need to submit as part of their binders. So for plan data, and we're on page 9 of the PowerPoint, for plan data, rates, plans, benefits, rating areas.
John,
Yes.
real quick. There's somebody typing into their speaker on the phone. If they could mute it, we can't hear the presenter. Thank you.
If you can please mute your phones, that'd be helpful. Thank you.
All right, so I'm going to roll back here a little bit. So we're going to talk about plan data and specifically the surf data file templates in regards to what would be modified or what might be requested in addition to the data that is captured in those files. So when it comes to the plan data, specifically rates, plans, benefits, rating areas, those type of things, there will be no Nevada-specific changes to the CMS data files. In addition, DOI will issue final guidance on when QHPs can start issuing the submission of those binders. We believe it'll be available 4/1, given everything that Surf has said. We believe that will hold true. So look to DOI for final guidance if, for some reason, on 4/1 you're not able to start submitting data. Moving to slide 10, John alluded to this a little bit earlier. This is information that was presented by the DOI back on the Industry Day on January 15th. However, final market rules have changed some of the plans there. So John, I know you want to kind of comment on this a little bit.
Yeah, so the original discussion at the rate and form filing seminar on January 15th indicated that we would have 4 rating areas, and that one of those areas would be Clark plus Pahrump. The division of, CISIO has flatly denied that request. And so the Division of Insurance is working with CISIO to establish appropriate rating areas that meet all the requirements of the feds. The current rule is that Nevada, because of the metropolitan statistic areas, can't have more than 4 service areas unless we request an exception, and whether or not that is actuarially justified, and whether we can actuarially justify that is another matter. So we're trying to work through that. We as in the state, and specifically the Division of Insurance, is trying to work through creating service areas that are appropriate for Nevada. So if you have concerns about that, please let us know. But we'll get that guidance out as soon as humanly possible.
Hey, John, this is Bob Shake with United Healthcare.
Yes.
Just wanted to provide input that given that CMS has not approved the previous rating areas that were submitted, we would prefer that to handle the Pahrump issue, that Nye County just be included with Clark County as a whole, and that would be something that we could live with. Because otherwise, if Nye County gets clumped in with the all other rurals, we wouldn't really be able to provide a plan, since we don't have networks and plans in the rest of the rural areas. So Pahrump might be left out in the cold from an exchange perspective, unless Nye County got combined with Clark County. Those are just our thoughts.
Okay.
All right, moving on to slide number 11, prescription data. So the prescription data used by the exchange will be submitted using the CMS surf data file. Again, there'll be no Nevada-specific changes to that. It's the exchange's intent to use that prescription data to assist consumers in finding their QHP offerings. And we are doing some ongoing evaluation if that surf data is sufficient to provide the consumers the intended functionality. We don't believe at this point in time we're going to need additional data from the issuers. because we can data match against other public sources, formulary, NDC drug lists, things of that nature, information that's not specifically captured in those SURF files. But at this point in time, we believe that it is sufficient to provide the intended functionality. Looking at provider data, I wanted to highlight this specifically because this is one area where there will be additional data required from each of the issuers in addition to the SURF data files. So we will be asking for data in addition to what the ECP file provides for. An Excel template will be published mid-April for the issuers to review. That will be initially submitted as part of the SURF binder process as additional information. There's an area within the SURF flow where additional files can be uploaded, and that would be one of those additional files. We are looking for the issuers to update that quarterly at a minimum, meaning that is a file process that would fall outside of that that annual filing process with SURF. And we'll be establishing a process for the issuers to submit that data. In addition, we are going to be requesting a link to your network-specific provider finder. So it's just a clarification of what we'll be looking for in the SURF data template, that rather than a general link to your directory, we will be looking for you to direct consumers to the network that is applicable to the product that they are viewing provider data for. Just to give you an example of some additional data fields that we'll be requesting that are not part of the SURF data file, things such as spoken languages, provider gender, specialties, and then any hospital and provider group affiliations. If we move to the next slide, slide 13, you'll see an example of some of the how that data would be used. This is a rough initial review, but you can kind of see some basic information about how it would display provider participation and affiliation and specialties, as well as the filters on those additional fields that we had indicated. All right, moving on to slide 14. So CMS in the latest version of the plan data files added an area for providers to add links to your plan brochures, your SBC documents, and other supporting collateral. So we are requesting that those links be completed in the SURF template. We are not requesting you provide those materials directly to the exchange. It is the issuer's responsibility to update and maintain the compliance of that data on their systems for the exchange to link to. It can either be a direct link that you put in to that field, or it can be a parameter-based link if you want to pass in things such as the effective date, the plan ID, and plan information. The exchange will be issuing guidance on what that URL format will look like for you to, the parameters that can be consumed, that we can post so that you can generate those documents. Again, that will be part of the April release of information along with the provider details.
So just to be clear, when an individual goes to enroll in a plan on the exchange website, and there's a link to the evidence of coverage or the summary plan description, that would actually take them to the carrier's website where they would maintain those documents.
Yes, that's correct. And it can be, like I said, rather than hosting up a single PDF for every one of them, there will be parameters that we will define that can be consumed as part of that, so that you can serve up the document. And we're requesting that those documents be provided in PDF format for view and display by the consumer. Item number 15, issuer logos.
This is Raj. Can I go back to the slide 14, please?
Sure.
After viewing the information on carrier side, would the consumer come back to the exchange to complete the app?
So I think that the link would simply provide you, it wouldn't.
Yeah, it wouldn't take you to the carrier site. It would be a pop-up. It's a direct link in an additional window for that consumer to view. And of
Okay,
course, the
thanks.
consumer can request a hard copy. Any other questions on the supporting collateral? Moving to slide 15, issuer logos. The exchange is requesting that the issuers submit logos in various sizes for both print and web-ready use. Uses of these specifically have not been defined, but we're requesting them as we will need to serve them up on various parts of the site or various parts of the UI. So again, keep in mind from a regulatory standpoint what logo you're representing, whether it's an issuer, it's your QHP versus a product logo. I know United, sometimes we have questions in regards to that because it's United Health One versus Golden Rule versus various writing entities. So you're going to need to clarify and make sure that you're providing the appropriate logo for usage with the QHPs that are being displayed. We're requesting them in both color and black and white and in a variety of sizes. Moving on to slide 16, John kind of touched on this a little bit in the beginning, but issuers will be provided an opportunity, as we said earlier, to review plan data in the Exchange UI prior to go live. We will be pursuing an integrated UAT or user acceptance testing approach with the vendor, with the issuers, to ensure end-to-end functionality. And as we mentioned earlier, more information we provide about that validation and testing approach. Closer release, I think John committed to mid-April there.
Well, at least a draft.
A draft,
A
yes.
draft. And understanding we're trying to build the ship as we're sailing it. So we want to make sure you have enough information. So we'll provide a draft out there again mid-April. We'll go April 15th. And if that's a weekend, it might be the Monday after. Bear with us. But then expect further releases of that information so we can refine that further later. We want to make sure, again, you've got enough resources to put to get this done properly.
All right, so that kind of brings us to the end of our first section, which is really about all of the plan data, the elements, the supporting collaterals, network rating areas, those kind of things. Before we move into the kind of functional IT requirements, are there any specific or general questions about the information that we just covered? All right, hearing none, we'll go ahead and move on. So on to slide 17, nice little title slide there saying IT requirements. Slide 18, really there's two key interfaces between the exchange and the issuers. The primary one being EDI. That's obviously how we're transacting between our entities, both from the exchange to the issuers and from the issuers back to the exchange. So we'll be looking to establish a trusted connection based on known endpoint, really with connecting IP address validation. So we'll be looking to set up a relationship where you know our outbound connecting IP, we know your inbound connecting IP address. We're able to set up a one-to-one relationship for specific access to your areas of the exchange SFTP to drop EDI files, and conversely onto your secure file transfer Dropbox for outbound EDI files from the exchange. There'll be a daily delivery of both 834 and 820, different iterations in both full and delta files, depending upon various timing. We're working through the exact details of where you'll be getting a full, where you'll be getting a delta, as we receive additional guidance from the feds regarding that timing and the details of it. Most of this information in terms of the document types has been previously shared. I wanted to put it back up there only because we had a correction to our last slide. We had erroneously put 997 as the response. That's an old 4010 standard. We're moving to the 999 acknowledgement specifically for those transactions.
And as we discussed before, our intent is to mirror wherever possible the federal standards, the FFE standards. We think that that will certainly help out the national carriers. It'll also help us out in future transitions if necessary. So we've been trying to influence those national standards where appropriate to make sure that all of our requirements are in there. I think we've gotten all those requirements. The only thing that isn't specifically in there are, I believe, plan riders are not accounted for in the templates. So riders would, I guess, be submitted as a separate plan, and then there'd be we'd have some way of indicating that that rider is attached to a certain qualified health plan. As you may be aware, the Plan Certification Committee decided to require that if you're going to offer dental, pediatric dental, or adult dental for that matter, that it must be offered as a dental rider separate from the QHP, that it cannot be embedded in the medical QHP. So we would look at that dental rider as if it were a standalone dental plan, and the intent is if you offered it as a rider specific to a specific plan, that only people who chose that plan would have that option to review it, to select it along with any other standalone dental product that might be offered to the public as a whole. Or you could offer it as a standalone dental product and offer it to anybody on the exchange. It's up to the carriers. And I'm sorry, so that decision will be discussed at the board meeting tomorrow. The board meeting, it starts at 1:30. It's in this room, and I believe it's in the Cheyenne campus of College of Southern Nevada, and it'll be a same phone line as well.
For the next type of communication that we want to highlight is a secure communication channel. Not everything from a business standpoint that the exchange and the carriers will need to interact on can be accomplished via EDI. Reconciliation, customer service, appeals, various pieces of information that are going to follow more of a business process flow as opposed to a systems integration flow. The exchange will be serving up an encrypted outbound email to a designated delivery inbox. The reason we call that out is that the exchange is not going to be managing a distribution group at the individual issuers of who should be receiving that information. We're going to ask for you to establish a functional inbox, and from there handle the distribution of and user rights of who within your organization should have access to that information based upon that delivery inbox. Some examples: finance, membership, appeals, customer service. Again, functional areas. As we go through more of the communication process, the appeals flows, we will provide a defined list of inboxes that we expect to be able to deliver communication to.
So just to clarify on appeals, I think we said this before, but I want to make sure everybody's aware. If it's a claims issue, that is all you. With the function of the exchange is enrollment and eligibility, and the associated appeals with enrollment and eligibility. So when we're talking about appeals, the exchange is required to have an appeals function, or let HHS do it. And I tell you, it's tempting to let HHS do it because it's a pretty complicated process. But the appeals process is for enrollment and eligibility. We're talking APTC, CSR, eligibility in QHP. We're also talking about appeals for the exemptions. We're required to do religious exemptions, affordability exemptions, and a couple of other ones. The other side of that, we've been asked, well, will carriers be able to appeal a decision? And I think that we have to offer that ability for a couple reasons. And the first example that comes to mind is somebody says, let's say that you require a surcharge for a tobacco user. Somebody says that they're not a tobacco user, and you've got information that says that they are. Theoretically, you should be able to say, hey, they are a tobacco user. Here's the information that shows that, and so we'd have to take that information and do something with that. So at least initially, the appeals function is meant to catch the things that we can't quite account for, and that's that is the fallback for these things that we don't have that are not necessarily automated yet. There was another example that I can't remember off the top of my head, but that's the idea is while the exchange is a system of record, we understand that you might have information that says that the information that we passed is incorrect, and you need to have an avenue to be able to discuss that with us.
Yeah, one of the other examples I think was given by United Healthcare in the last session, where they had indication via claims that an individual was maybe residing outside the planned service area now and that may not be eligible, and what their recourse would be to redetermine that eligibility because of their claims experience.
This is Lisa Kelly-Manson. Does that also include potential fraud?
Yes.
Like if we detect somebody is, not doing what they're supposed to be doing.
I would say yes. I can't say that exactly where that would fall within the exchange, but we'd have to look at each item on a case-by-case basis. But certainly, if somebody's committing fraud, we'd want to committing fraud due to the services that we offer. We would certainly want to know about that and deal with that issue.
Okay.
And would the issuers be able to submit that termination because the issuers, as outlined in the regulation, the new proposed rule?
I think that we need to have a better handle on exactly what that is, and let's look at the regulation. We'll get back to you on that one.
Okay. The other question that I had is another new proposed rule came out regarding that the Fed will not be offering employee choice and not be aggregating the premium for the groups. Is Nevada still intending on aggregating the premium?
Yes. My read of that was that the FFE implementer said, holy cow, we can't do this in time, change the reg for us,
right.
And that's what they did. It is our intent to offer all the services that we have indicated that we're going to offer. We think that premium aggregation is an important function. Not only are we going to offer that, and as you all are aware, not only are we going to offer that on the shop exchange, we're also offering it on the individual exchange since we're doing the billing for the individuals. There has been some questions about, we've received comments from carriers that are concerned that they don't like the idea of giving an option to an individual for a year to be able to send payments directly to the carrier. That they would prefer that if somebody comes to the carrier, that they simply try to encourage them to come to the exchange. We'll look at that. It would be our preference that everybody came to the exchange, but of course the law requires that we allow that the exchange allows an individual to go to the carrier. I don't know if that means that a carrier can make it their policy to receive or accept payments. So we'll look at that and we'll take another look at that and see how we might make that work.
Okay.
So next meeting. Oh.
So we did have some questions submitted by one of the issuers, so I wanted to get through some of them. A lot of them specifically dealt with details around the 834 and 820 transactions, and even technically down to various loops and subloops and things of that nature. So I wanted
Before we get to the detailed questions, this is Bob Shake with United. Just general question, EDI slides that you just presented on 18. I didn't pick up on the electronic transmission line for APTC and CSR, whether there's going to be one or multiple different types of transaction or transaction formats, or what's implied by saying electronic transmission. Is that going to be a custom interface that the state's going to define, or are you waiting for the FFE to define how they're going to do it?
So some of it we're waiting for guidance on. We believe a lot of it will be captured in the 834 and 820 as we see additional guidance come out on those documents. It is our intent to capture everything that can be done from an electronic perspective in those 834 and 820 transactions. If there is, for some reason, a business element that the exchange and the issuer must transact upon that cannot be defined in that, we will have to define an interface and a method for transacting that. Right now, we're not specifically aware of transaction types that fall outside of it, but guidance being what guidance is, if there is changes, then we will notify the issuers as that approaches. One of the reasons that we actually put some of the electronic integration pieces towards the latter portion of the onboarding, it's actually scheduled for middle to end of April 24th. It's really looking at the file transfers and really in that individual side when you're talking about APTC, CSR, all those other elements that aren't part of the membership piece. We are looking to have a lot more defined guidance and process around that, so that by that April session, we can give you the details if there are any other interfaces outside of the 834 and 820.
So
the federal CMS has indicated that they are adopting the HICS 820 version. So I'm just wondering, will the state follow suit in alignment with the federal for the actual APTC CSR subsidies payment? And then in addition to that, for the premium payment that would come directly from you all to the issuers, would you then use the HICS 820 as well, or would you use the 5010?
So we will be using the guidance for any of the federal guidance for the Federal Facilitated Exchange will be the implementation that Nevada uses. So we will be using that format. In terms of the 820 for payment remittance ACH, right now we have a companion guide for the 5010. We may roll that into the HICS 820.
Okay, so really so either way, you're not going to support two types of 820 transactions.
That's correct. It'll be one 820 transaction, and the
okay,
intent
and it'll probably be the HICS.
Yeah, the intent at this point in time is to be the HICS 820.
So the HICS 820, that merely reflects a payment for an individual, group, whatever, right? Or basically an individual.
Right.
So the 834 file is what actually transmit APTC and CSR data, because that's attached to enrollment.
Yes.
Right. So
right, but the APTC CSR will be it will be the notice of the actual payment of the APTC and CSR, and behind it, that unbundled will be the actual payments, the ACH.
All right, so the exchange is not going to be part of the payment of APTC or CSR from the feds to the carrier. That's between you and the feds. So,
yep.
So we are going to, so the APTC and CSR is attached to an 834 file from our perspective.
Right.
Because that is really attached to an enrollment. And the prime example of that is if somebody chooses not to pay for their, so let's say they pay for the first month in January, and they don't pay in February, they go through the 90 days, and now they got to be terminated. The rule requires that they be terminated to the end of February, even though they haven't paid for February. We have received confirmation that the carriers will be reimbursed for APTC and CSR for February. So you at least get that part of the payment. You may not get the individual's piece of the payment. So therefore, the APTC and CSR has to be attached to the enrollment, not to the payment. So from the exchange...
Right, but we still have to get, I mean, we'll get that. Basically, you're telling us what it should be. But we're still going to be getting the actual payments, and we'll at some point need to reconcile about what we actually got and what you said we should get. I mean, there has to be some, form of recon there, because obviously there can be mistakes made, and information that was passed to us maybe didn't get passed back to the Fed and or was different, and so we have to be, recon in some shape or form. But when you just gave your example, you meant that they'd paid their initial payment, right? And the enrollment had been effectuated.
Yes, the only way you get on the exchange is if you make the first month's payment.
Right. For some reason I thought you said, you might be canceling a bag, and I thought you were originally talking about the initial payment. I was just going to say we would never have effectuated them. So, okay.
Yes, so to be enrolled, you have to file a complete application on the web portal.
Yep.
And then you also have to submit payment. Once that payment is processed and everything is confirmed in the application, we will send you an 834 file with the enrollment, APTC, and CSR. And then we will also send you an 820 file for the payment piece. And then I think we send an 834 file each month.
Yeah, they're going to get, they'll get full file feeds, but they'll also get change files. So yes, there will be a monthly there's a question regarding that there will be a monthly reconciliation process.
Right.
It won't be any more frequent than monthly.
So we send you an 834 file every month for the enrollment. When we send an 834 file to you, we also send that same file to the feds, to CMS. So they will, assuming that the technology bridges are intact, they will get the same exact information that you get. The 825, I think they actually have to get the 820 files as well. So they also get the 820 files as well. So again, that example was somebody paid for January, they're covered for January, then they stop paying for future months, or at any time during the year they stop paying it for future months. Because of the 90-day grace period and the payment of claims for the first month and pending claims for the next 60 days, if they reach the 90-day, end of the 90-day period, they have to be retroactively terminated to the end of the first month of non-payment. So in this case, if the first month of non-payment would have been February, you would still get the APTC and CSR for February. That would have been attached in the enrollment file. However, any of the changes that would that retroactivity would reflect that they are no longer covered for the months of, in that case, March and April, and so there'd be a reconciliation piece on that side. Now, I don't know exactly what the feds are sending you, the carriers.
Yes.
Go ahead.
Oh, sorry. This is Michelle Lacey again from Anthem. One of the things that I had a question about was from the existing flow, with the 834 enrollment along with the 820 premium for the individual coming to the issuer, are you waiting on the 834 response transaction before you initiate some sort of a trigger to release the APTC from the feds?
Yeah, the exchange would never release APTC from the feds.
We are simply sending the 834 file to you and to the feds to indicate that somebody has enrolled in your plan.
But you're going to also send them notification of effectuation when we tell you well, you'll know it because you're collecting premium in this instance. You're collecting the initial payment.
Right, so the 834
So really
file,
at that point, got it. Okay. So
Yeah,
there is going to be
a question around that, speaking of that. Are you guys going to send us 834s before you've collected initial payment, or will you just wait until you get the initial payment and then send us
so
the 834 already ready to be effectuated because you held the 834 until you got the initial payment?
So the idea is, as long as we are receiving the payment, that we would send you the 834 file once we've received payment.
Okay.
However, the issue where an individual can pay the carrier directly throws some kinks into that, and we need to work through that process in a little bit better detail.
Yeah, and you've also got the tribal elements.
Right, and I think actually I did some. I know I owed you. This is Lisa Kelly. I said I was going to send you some comments on that, and I don't know if it's been sent over to you yet on that whole particular issue around availability to pay the issuer and all that kind of stuff. So.
Yeah, we received that email, and that's what we're going to work through.
Okay, great.
From an 834 response perspective, you're not anticipating receiving an effectuation response from the issuer. However, you do want to have, I'm assuming, some sort of 834 response should the issuer cancel due to non-payment of ongoing premiums, or?
Right, so we send an 834 for each enrollment period, meaning for each month, we send you an 834 file. We get a response from you indicating that you received it, the 999 file. In the future, if the individual is paying you directly, they may decide to stop paying, and so you would need to initiate enrollment. So to indicate that termination, you would need to send the exchange an 834 file initiating termination of that individual because of non-payment.
Right, and I want to, because I know next week we have this call, and I wanted to talk further about that whole process and kind of what you guys had proposed and work through that a little bit more, because I just see a lot of problems, but it's all in that document that we've sent over to kind of talk and work through that. Just some pros and cons and how the difficulties surrounding that when, you guys own the AR, but we own the payments, and it's just some difficulties there. So
we understand, and so if you could let us look through that document first and discuss that internally, and then we'll make sure that we get that on a future agenda.
Great.
And I'd like also to point out that there is a whole agenda item. Is that March 27th? Oh, April 24th for that process. That said, if you're looking at the schedule, again, resources and carrier onboarding webpage, on that schedule, right now it goes out to June 5th. There was some concern about certain pieces of that going out too far and whether or not we can compress it. We are going. We haven't had a chance to look at that yet. We'll look at this with Choice and Xerox and determine if we can compress this schedule at all. Again, we want to get you the information that you need in time to implement. And it might be that some of the information isn't finalized by the feds, which is why some of this is pushed out a little bit. But we're going to do what we can to compress that for the carriers that had those concerns. If anybody else has concerns and have not expressed it, please let us know. You can send me an email, and we'll look at your concerns as well.
Now, this is Bob again, from United. The other general question I had was on the encrypted email, page 19. Just to clarify that, are there going to be multiple designated delivery inboxes by function, or is there only one designated delivery inbox and everything would go to that?
You know, there would be multiple delivery inboxes by function, and part of the reason that we're doing that is we're putting the responsibility on the issuer to manage who has access to those functional area inboxes. So yes, there will be, and from a security HIPAA standpoint, who has access to what information. Finance doesn't necessarily need to see appeals and those kind of things. So there'll be designated inboxes for specific work items based upon what type of communication needs to go to the issuer. And most of those aren't going to be, most of those would be more workflow-driven communication, not transactional, data-driven communications.
Okay, thanks.
All right, just looking through some of the other questions that were submitted here. So there were some questions in regards to expected responses. Yes, the exchange will be expecting a 999 response from the issuers when a file is submitted. And conversely, the exchange will issue a 999 when we have successfully received a file from the issuer. We can see if there are any other specific questions. There were some very specific questions that came in regarding the EDI. We will take those back and answer them and post those answers online as a summary of the questions here in regard to that, only because they get pretty technical, and I want to make sure we give the most appropriate technical response to those answers.
So I have one general question related to the enrollment process.
Go ahead.
You said you'll be sending the enrollment information after receiving the payment, but are you going to hold until you receive 100% binder payment, or would you be sending the enrollment info as soon as you receive the partial payment for the first month of premium?
For first month of premium, it has to be payment in full. We have a policy not to accept partial payments, but we understand that that is unrealistic, that there will, I mean, the intent is obviously to get full payments, but there will be people that send in a check that doesn't match the amount. When we receive payment of any kind, we will send, I'm not sure about the first month enrollment, but during the plan year, we will send that payment to the carrier, whether it's full or partial payment. There may be instances where we can reject certain partial payments, and we got to work through some of that. But for the initial enrollment, they'll have to, I'm getting kind of people.
No, continue on. I have a question after.
But for that first enrollment, they have to provide full payment to enroll.
And so my question would be, in the case where they're paying the carrier directly, wouldn't we send the 834 down for enrollment, and the carrier would actually send an 834 back to us later on saying they actually received payment and then the enrollment process is complete?
Yes, but I want to look at the paying the carrier payment. we want to look at the policy of paying the carrier directly and how we do that before we say how we're going to do that exactly.
Okay.
We have to, I think we need to look at this, and we need to look at the email that I received from one of the carriers as a group and discuss it and see what makes sense.
One of the reasons for that.
United Healthcare. And in regard to carriers receiving payments, would you be expecting an 820 file then from the carriers?
Yes.
Okay, that would be the only instance where you would require an 820 file from the carriers?
The only, yeah, 820 file only indicates whether payment has been received. It's only to indicate payment. So we will only send you an 820 file when we get paid, and you'll actually get money with that payment. And then you'll send us an 820 file indicating that you received payment.
I don't think we had talked about that last part where the carriers would be sending us that they received payment. I think we intended that, you know, if you ever send us an 834 that you're disenrolling them for lack of payment, our assumption is that they are paying through those timeframes. Again, this is where the carrier is accepting the payment as opposed to us.
All right, we'll work through that side. Give us a couple of weeks to get through that.
Yeah, clearly there's a lot of
okay, thank you.
discussion and process flows that need to be worked out on that carrier payment side.
But that's not to say, of course, we wouldn't love to
Did you
know
also
that they
say
paid,
that you were going to be sending monthly full 820 files to the federal?
No, the federal
No.
does not get 820s.
Yeah, be 834.
Okay, they only get 834.
All right, looking here through the rest of the questions here. I think we've pretty much covered most of the general questions that are here. Again, we'll go through and detail out the answers for these and post the responses to the Exchange website shortly. I know we had a lot of questions regarding the EDI part, the electronic transaction part. Are there any more questions specifically around the rates, plans, benefits, the SURF data files? I know there's a lot of information out there. SURF has been socializing it, NAIC has been socializing it with the carriers, but I want to make sure that there's any other questions in regards to that.
Well, this is Archer Canella from Anthem, not specifically about the templates, but more in regard to the forms filing in terms of including EOCs and schedules of benefits. Do I understand correctly that there's to be no variability for an EOC filing or schedule of benefits?
This is Glenn Shippey from the Division of Insurance. What we're not allowing is variability in benefits. You know, we're still going to allow variability in other areas of the EOC, but actual variability in benefits, we're not going to allow that because we're going to need to look at a specific benefit design for these new areas that are required around, make sure they're not unfairly discriminatory. We need to identify, you know, around meaningful difference, actual equivalent substitutions, et cetera. So variability within benefits is not going to be allowed. So you'll have to submit separate filings for each permutation or variation of a benefit.
Okay, and that makes sense for things like cost shares. You won't be accepting like a cost share range as you would today,
right,
like a co-payment range or what have you.
Right.
Okay. So will there be details or instructions released, Glenn, later on for forms filing or expectations around those at all?
Yeah, we are in the process of putting guidance together for carriers, and we intend to distribute directly to carriers and also post on our website information to assist in putting filings together, what our expectations are and what our review process is going to be.
Oh, that sounds good. Is that expected soon or in the next month or so?
Well, you know, it should be pretty soon. Yeah, I'd say, you know, in sometime in April.
All right, that sounds good. All right, thank you. I appreciate it.
Not the federal definition of soon.
So there's a couple other just general questions from an operational perspective. One of them was in regards to changes that might be made by an individual, change in health coverage levels, a change in circumstance, and one of the special election periods, for the shop, address changes, things like that, where those transactions would be effectuated from. The exchange is the membership system of record, and as such, those changes would need to be made in the exchange's system and then transmitted to the issuers via an 834. So changes in address, things like that, would be a push from the exchange to the issuers.
So if somebody came to a carrier and wanted to change something like that, the way that a carrier could do that is if they could basically have their agent log into the web portal. The individual would have to indicate that that agent can act on behalf of them, and they could do it that way. But the individual has to provide another individual the status of act on behalf of to be able to effectuate the changes. Otherwise, that change has to be done by the individual. Now, there's exceptions to that, power of attorney, stuff like that. We could call the call center and we can make that update, but generally they have to go to the web portal or to the call center to make those changes. Now, if somebody called in, you could do a hey, this is so-and-so with Anthem. I have John Smith on the line. He wants to change his address. He's called the CSR, and the CSR could do it that way. But ultimately, if they have access to the web portal, that's where we'd like them to do it. And those are basically the mechanisms of how you can have them change, but it has to be done through our system. Otherwise, things get out of sync and it doesn't really work out real well.
Okay. All right, I think that answers all the questions that were submitted.
So that was, we actually had 2 sets of questions, and I don't think that I brought Chad in on the other ones. The ones that were posted online, separate set of questions, the answers are there. I apologize, Chad.
Okay.
There was a second set of questions that he received that he's been going over. We will post those questions on our website for today's meeting as well. So please go through the questions and responses. If you have further questions, as always, please send them to us, and we will get them posted as soon as humanly possible.
This is Adrienne from Anthem. I do have one additional question real quick. Will the state of Nevada require off-exchange products to also be filed in the QHP templates?
The DOI, Glenn is shaking his head no.
I'm gonna say, however.
However, he said no, but however. If it doesn't translate, then head shake.
There's some macros that are being developed that are going to be running within these templates that would greatly expedite the review process for carriers. For instance, around EHBs with the formulary rules and drug coverage per pharmacopoeia class, if the drug template was actually submitted with the, within the forms filing for an off-exchange product, that would really help us in running that count to establish that the carrier does meet the minimum amount of coverage in each pharmacopoeia class. So there's I don't think we're going to, I think when we put out guidance soon, it will encourage carriers to provide us with certain templates that will assist us in expediting the review of their product submissions.
Okay, thank you.
So please, if you haven't signed up for meeting notifications, please do so on our Exchange website. Again, exchange.wd.gov, resources, carrier onboarding. I believe the first or second link is sign up for notifications. Please do that, and we'll send out all information via those links. Our next meeting is scheduled for March 20th, and agenda item is certifications and network adequacy. I don't think we're going to have that done well, we're supposed to post that information today, so we will not have that done by then. So I'm going to go ahead and cancel the March 20th meeting. We're going to push that March 20th agenda item back to the first Wednesday in April. So our next meeting will be March 27th regarding enrollment payment for individuals. The meeting after that will be I believe it'll be April 3rd, certifications and network adequacy. Hopefully we'll have something for you at that point. And then the meeting after that will be the April 10th enrollment payments for SHOP. So we will repost this agenda. And actually, I think our meeting schedule Give us a couple of days to repost it with the ending ones compressed earlier potentially. We'll discuss that with Choice and Xerox and see what we can do with that. So give us to the end of the week to look at the new agenda, but right now we're going to go and cancel the March 20th meeting.
This is Lisa Kelly from Anthem. I just have a question on. I signed up on your website, on the website, to get email notifications. That I did it the day of the last meeting. I don't think I've gotten anything. Have there been things sent? I'm wondering if something I didn't get signed up completely or something.
The last notification that we sent, I believe, was on that day. It's been a while. We will send out a meeting notice today just to test it out. Okay. Okay. So if you don't get something today, then start being worried. Let us know.
Okay. All right. And then for folks on the phone, sometimes that may end up going to your spam folder because I ended up finding several of the listserv notices that went there.
Could you give me that website again, please?
Exchange.nv.gov. If you click on the Resources tab, should be about the 4th or 5th tab. And then on the left side, you'll see Carrier Onboarding. And then all of the information from the last meeting, from this meeting, the schedules, the link to the listserv, the notification for adoption of the rates, all that stuff is on that webpage.
Perfect, thank you.
Earlier you said you had a 5010 companion guide. Is that something we have access to, or is it still in flux?
You know, I will check on that. I believe it's still in flux, but we'll get you an answer on that. There was a question that was asked in the from United in regards to if there's a companion guide. We'll validate that our companion guide is current for the current regulations and provide that. Obviously, you have the federal companion guide. Like I said, it's our intent to use that if at all possible.
Okay.
And we believe that to be the case at this point in time. So the feds have published their companion guide.
Any other last questions? All right, well, thank you very much.
Michelle Lacey.
Oh, go ahead.
I'm sorry, from WellPoint or Anthem. Will the enrollment payments discussion for individual and shop and the reconciliation discussion, will they all be inclusive of more information on the EDI?
Yes, they will touch on EDI specific information. That would be more of the specific details about what information will be transmitted in those. The mechanics of that is more what would be covered in the later session. Yeah, so the April 24th is going to be more about the mechanics, the timing, the standards, those kind of things, whereas the 2 prior meetings for individual and shop will more cover the content of what would be transmitted.
Okay. Thank you.
Anything else? Anybody in here? All right, thank you very much. We'll talk to everybody on March 27th. You should receive the content for that meeting on March 20th. And so, again, we'll get a test message out today. We'll get the revised schedule out on Friday, and we'll get the content for March 20th, or for March 27th out on March 20th. Thank you.